All right, let's jump right into this explainer. If you've ever found yourself wondering how these massive hospitals manage to keep track of literally thousands of moving parts every single day, everything from patient triage to super complex billing, without just collapsing into total chaos, well, you're in the right place. We're going to look at exactly how modern healthcare facilities completely eliminate that administrative friction. So today we're walking through a complete product demonstration of Healthplus. We'll be looking really closely at how it acts as, essentially, the central nervous system of a hospital. Created by FAS26 Enterprises, this ERP software isn't just some boring, static database. No, it's a living, breathing digital ecosystem. It's specifically designed to take all those isolated departments and connect them into one perfectly synchronized machine. To get a grip on how this all works, we're going to cover 5 main areas. 1. The Hospital Command Center. 2. Core medical frontline operations. 3. Diagnostics and inpatient census. 4. Supply chain and billing. And 5. Governance, finance, and audits. Let's kick things off with part 1, the Hospital Command Center.
Okay, so right here in the command center, real-time analytics, things like pharmacy sales, your daily revenue, and which specialists are currently on duty, they're all instantly visible. You absolutely don't have to wait around for those end-of-month reports anymore, or waste time cross-checking 5 different systems. The overall health of the entire hospital is just right there. It gives you this immediate context on recent outpatient or OPD registrations and highlights exactly which doctors, like, say, Dr. Sanjay or Dr. Rohit, are actively working on the floor right this second.
And notice how having this data instantly really drives your decision-making. I mean, think about it. When you see a critical metric pop up, like an 85% occupancy rate in the inpatient department, you can make these instant, proactive decisions. You can adjust staffing, manage beds, or divert emergency room traffic on the fly, instead of just reacting when it's already way too late. It's a real game changer.
Moving on to part 2, Core Medical Frontline Operations.
So the Core Medical Hub sets up this really clear, highly structured workflow right from the second a patient walks in and registers, all the way to their potential admission into a ward or the ICU. It's a totally linear journey, right? It starts at the receptionist's patient registry, moves to the appointment scheduler, flows right into the consulting doctor's clinical notes, and then eventually lands at the inpatient management desk if they need critical care. This literally saves frantic nurses and staff from having to constantly run around chasing down physical paper charts.
Now, if you have ever pulled your hair out over lost paperwork or having to enter the exact same data 3 times, just look at this. Entering demographics just once into the patient master instantly populates a dynamic, completely trackable records registry. It takes this clean registration form, which captures the whole shebang from blood group to third-party administrator or TPA insurance details, and instantly turns it into a robust, searchable database. So it tells you right away if a patient, like Suresh Chauhan, for example, has a pending balance or if his account is totally cleared.
And this data flows directly into the OPD registry. This gives the staff a fantastic, comprehensive view of patient statuses, total bills, and pending payments for that specific day. The interface shows you exactly who is sitting in the waiting room, whose clinical records are finalized, and what the financial status of each consultation is. The front desk knows exactly where every single patient stands in real time. It completely removes all the guesswork.
Okay, so here is the really crucial point. When a doctor actually conducts a checkup, the data entry is structured so cleanly around vitals, symptoms, and diagnoses, all housed in one unified interface. This module captures things like systolic and diastolic blood pressure, pulse, temperature, SpO2, and weight just beautifully. It standardizes the care process, which makes sure that absolutely no critical baseline metric is accidentally skipped when a doctor is rushing through a crazy fast-paced shift. All right, let's jump into Part 3, Diagnostics and Inpatient Census. Just imagine you're a clinical director, right? You open up this live hospital census and instantly see every active, admitted patient, their exact ward assignments, and their attending doctors. It gives you a literal map of the facility. You can look and immediately know, okay, Anand Mishra is in the semi-private ward, bed B101, and he's under the care of Dr. Anna Shah. It gives you total, absolute visibility into where every single patient is situated at any given moment.
Meanwhile, in the background, the diagnostic workflow is systematically pushing lab results and radiology interpretations straight into a single electronic health profile. The laboratory information system handles all those diagnostic templates and flags any abnormal values for you. At the same time, the radiology module is handling the really heavy stuff, like X-ray or MRI image uploads. All of this data aggregates automatically. That means the attending doctor doesn't have to go hunt down lab technicians on the phone. The results just magically appear right there in the patient's consolidated file.
But all this incredible clinical care relies super heavily on back-end support. And that brings us to a really important question about resources. How does a hospital ensure the right medications are even in stock before a doctor prescribes them? Because you can have the absolute best doctors in the world, but if you don't have an airtight supply chain, your hospital operations are inevitably going to grind to a screeching halt.
Which perfectly leads us to Part 4, Supply Chain and Billing.
Let's look under the hood here. The supply chain software maps out this flow. Flawless route. It goes from a department requesting an asset to vendor purchase orders all the way down to logging specific batch numbers and expiry dates. It handles material requisitions from internal wards, it automatically generates the official purchase orders for external suppliers, and it meticulously updates the medicine inventory while managing internal stock dispatches. Honestly, it is total, uncompromised inventory control. And simultaneously, the Billing and Care Directory is juggling everything from cashless insurance pre-authorizations to tracking a patient-specific dietary instructions. It handles the consolidated billing, it untangles the really complex web of third-party administrator claims, and it even oversees hospital support services. We're talking dietetics, kitchen dispatch, and even ward linen and laundry circulation. It really highlights that running a hospital isn't just about medicine, right? It's about hospitality, hygiene, and super smooth financial processing. Finally, let's wrap up with Part 5, Governance, Finance, and Audits.
So the Fiscal Governance module acts basically as a double-entry accounting ledger. It completely automates these massively complex tasks, like calculating doctor commissions. We're talking about comprehensive chart of accounts configuration, seamless banking and receipt integrations, careful management of your assets and journal entries, plus fully automated HR and payroll. It handles all that heavy financial lifting totally silently in the background.
And guys, this is where the sheer power of an interconnected system truly shines. It automatically aggregates multi-branch data into trial balances, tax compliance returns, and forensic audit hubs. The system lets auditors drill right down into profit and loss statements, easily manage GST returns, and rely on an accounting audit hub that actually traces every single user action. Absolutely nothing slips through the cracks here. Plus, the system governance tools guarantee that administrators keep 100% control over user authorization rules and legal compliance trackers. It sets up the core clinical master setups, runs interactive compliance registers, and enforces really strict role-based user access management, so staff only ever see what they actually need to see. It even allows for multi-branch entity switching if you're dealing with massive hospital networks.
So, what's the big takeaway from this explainer? Well, it's a simple but incredibly powerful reality. Disconnected operations create friction, but unified ecosystems create efficiency. Healthplus connects all these isolated departments into one seamless, self-updating entity. Think about it. When the pharmacy sells a medication, the inventory updates, the patient's bill adjusts, and the general ledger records the revenue, all in one single action. It really challenges us to completely rethink our standard of operations, and it leaves us with one final thought about the true cost of outdated workflows. If your hospital is still running on fragmented software, how much time and revenue are you actually losing to disconnected systems? Let that question sit with you as you evaluate your own facility. Thanks so much for diving into this workflow explainer with me today, and keep looking for ways to build smarter, more unified systems.